We know that up to 20% of teenagers can have an episode of depression before they become adults, and that the majority of these teenagers don't actually access any help before they become adults. And so it is a very serious problem. And so a lot of them end up having recurrences as adults, and they also suffer through their teenage years with depression. We know that depression can affect their ability to function at school, their relationships with friends and with family. And so for all of these teens who are suffering, it is a very difficult and trying time, and also for their families too. And so one of the goals of our department here at Sunnybrook Health Sciences Center is to help teenagers with depression access treatment in a timely manner and to get better so that they can get back to all the things that they're supposed to do as teenagers and become healthy adults. So even though our department is very rich in child psychiatry resources or child mental health resources, we have over 8 psychiatrists who work here in that department. There's still a major shortage of child psychiatrists in the province and in Canada and actually in North America. And so a group of researchers led by myself and also colleagues of mine from Columbia University developed guidelines to help family doctors and pediatricians manage depression in teenagers in their clinical practices. We know that teenagers generally like their family doctors, they like their pediatricians, they've been seeing them for a long time, and they also trust them. And so we felt that that would be a good place where they could access help if they wanted to. There's also still a lot of stigma around mental illness in our society, and so the other advantage of getting help from your pediatrician and family doctor is that you would sit in the waiting room as if you have a cold or a sore throat, and no one really has to know that you have a mental health issue. And so the guidelines for adolescent depression primary care, or GLAD-PC, were developed over the last few years, and they were just published and released in November of 2007. And the guidelines are available in a publication format, but it's also available as a toolkit. The toolkit has many different instruments and resources to help family doctors and pediatricians actually treat these patients in their practices, and is downloadable on our website at www.gladpc.org. Even though we've developed GLAD-PC, we understand that there are lots of different barriers that stop them from managing these patients in their practices, even identifying or asking the first question of, how has your mood been? And so when they look at the toolkit, which is a pretty large document, I think many of them can feel quite overwhelmed. And one of the first things to remember is that we're all in this field to help teenagers and children. And so what they can do is actually start by looking at their own practices and seeing where they feel most comfortable starting. So for example, they may just want to start with asking a question every time a teenager comes in, or they may want to use one of the screening instruments that we have in the toolkit and actually have their receptionist hand it out to patients as they come into their office and wait in the waiting room. Or they may want to connect up with somebody in the community and learn a little bit more about depression before they kind of take on this task. So I think it's really small steps, and to try to take on the toolkit all at once can be quite overwhelming, and I think it's important for them to realize that it's okay to take small steps and to start with just a small piece of it. And as they get into it, what we've learned from our experiences with other areas or practices that have taken on this task is that it gets easier as you take on the small bits, and then eventually you actually realize you're managing full cases on your own with a lot of confidence and success. So major depression is a mental illness that commonly affects teenagers. As I mentioned, up to 20% of teenagers can have an episode of depression before they reach adulthood. What's the most serious consequence to depression is actually suicide. So we know that about half of teenagers who have committed suicide have had a diagnosis of depression prior to their death. And so we know that it's a serious problem. It not only affects what's going on right now, it can also lead to problems in the future with their employment, with schooling, and with relationships. And it can also lead to a serious outcome of suicide. And so we want to make sure that teenagers who have this problem are identified and treated. Now, there's been a lot of controversy out there about a number of things. The first being whether teenagers can get depressed and whether they need to get treated, because a lot of symptoms of depression like moodiness, being cranky, having difficulties in their relationships. Those can all come with being a teenager or someone who's having a difficult time. But I think it's very important for all of us to remember that teenagers can get depressed, and the signs of depression are very clear when you look for them, when you know what to look for, such as being tearful or sad, being irritable or cranky, being withdrawn, having difficulties with your sleep and with your attention and motivation, and then thoughts around wanting to die. And parents and teenagers really need to watch for these signs, and when they notice them, to bring that to the attention of a healthcare professional. And then there's also been a lot of controversy about treatment in terms of whether treatments are effective and safe. And I think the expert opinion, and based on the evidence that we have out there on research that's been done, is that there are many treatments that are effective and safe for teenagers, but choosing the right one is the most difficult decision sometimes. Whether a teenager, for example, has the motivation to come for psychotherapy once a week for an hour versus taking medication. Sometimes there's a big debate between parents and teenagers, what's the best route to go. And so what we know from research is that doing both talk therapy and medication is the best treatment, but sometimes that's not possible. And so the important thing is to remember that this is a personal decision, something that the patient and her parents have to make a decision on based on information from their doctors. And so I think the worst thing that can happen is that no one recognizes it, and then the teenager actually suffers in silence. So we know that depression is a very common illness, as I've mentioned, and that it affects a lot of teenagers, and a lot of them end up having recurrences as adults. And actually, the World Health Organization has noted that depression will become one of the leading causes of disability worldwide by the year 2010. And so we know that depression causes a great deal of burden in our society and productivity. There are a lot of days of work that are missed because of that. And a big part of it is that it's still really hidden, and that people are not talking about it and not dealing with it. And so I think it's very important that we address this issue now, and start with the young people who actually have less stigma around mental illness and are more willing to access help. And if we can help them, then we can help a new generation to acknowledge mental illness is a real illness, and to address this problem as they become adults. I think that if you're depressed, you need to talk to someone, and if the first person you talk to brushes you off or doesn't acknowledge that you're not feeling well, then you need to go talk to someone else. And there are lots of resources online, one of which is obviously our Sunnybrook website, but also the Mood Disorders Association of Ontario has many resources if you don't feel that you're getting the help that you need.